Most people living with hepatitis are unaware they're infected, and that's a little scary because chronic viral hepatitis is the most common risk factor for liver cancer. Because not everyone shows symptoms, identifying who is at risk and encouraging them to get screened is critical in reducing risk. Dr. Garth George of Advanced Gastroenterology and Surgery Associates explains the different types of hepatitis and their causes.
Hepatitis basically means inflammation of the liver, and there are many things that can cause hepatitis. First off, most people think of the viruses when someone says hepatitis, but the list of things that can cause inflammation of the liver are extensive. Not just viruses, but alcohol, medications, some diseases called autoimmune diseases where the body's immune system attacks the liver. However, most people concentrate on the hepatitis viruses. Of the viruses, there are approximately 5 hepatitis viruses, A, B, C, D, and E. The one that's causing the most difficulty right now is hepatitis C, which when patients become infected, the majority, at least 85%, develop chronic liver disease, which can lead to cirrhosis and its complications thereof. It really causes acute symptoms where patients may be sick or get jaundice like you do with hepatitis A and B. The symptoms can be very subtle. Most patients may complain of just feeling a little bit fatigued, which you can attribute to many other different things. However, the vast majority of patients are totally asymptomatic. We sometimes see patients just presenting with a complication of cirrhosis, not even knowing that they had hepatitis C. And it takes a couple decades to do that. That's the issue that we have right now with hepatitis C. It's the biggest reason that liver transplantations are done in this country. There's no vaccine for hepatitis C. We have vaccines for hepatitis A and B, which when we diagnose a patient with hepatitis C, we check to see if they have autoimmunity to A and B. If they don't, then they should be vaccinated for hepatitis A and B. D is a partial virus that has to be interlined with hepatitis B. So the patient has to have hepatitis B and they get D because D needs certain parts of hepatitis B to flourish. So without B, you can't have D. It's called the Delta virus. And it's more common in the Mediterranean area. Hepatitis E is a virus just like hepatitis A. And it's more common in the Indian subcontinent where it basically runs a course like hepatitis A, but its risk is mainly in patients who are pregnant. Hepatitis is not the death sentence it used to be, and it can be managed. I think the difficulty comes in diagnosis. We need to try to diagnose the patients as quickly as possible.
For more information on Advanced Gastroenterology and Surgery Associates and their services, please click the silent Epidemic story link icon on our homepage, yourhometownhealth.com.